Welcome to AgeLess. I'm Dr. Jonquille Chantrey, and this is a podcast about uncovering the truth about healthy aging, self-development, and medical aesthetics. Lifespan has increased dramatically by about 30 years since the mid-20th century, but healthy lifespan possibly hasn't kept pace, meaning many more years lived with compromised vitality. On top of that, approximately 70% of women say they feel invisible as they age, especially entering their 50s, due to ageism and a cruel cultural double standard. This contrast between extended life with limited health and examining the different causes of cultural invisibility drives my life's work. As a surgeon, beauty scientist, research, and yoga instructor, I've examined aging through the lenses of data, culture, physiology, and psychology. I don't see aging as decline, but as evolution. And in my philosophy, aesthetics, longevity, and mindset are inseparable. When aligned, how we look speaks to our vitality, our purpose, and our authenticity, not to time. That's what AgeLess is about, a deliberate rebellion against uncompromising and reductive beauty ideals, false information, and flat narratives of aging. We bring together science, self-expression, and health, creating a space that honours both body and mind. To start this series, there's no one better than Francesca Ogiermann-White. As Tatler magazine's health and beauty editor-at-large and founder of the Beauty Triangle, she shapes conversations around aging and aesthetics with rigour, empathy, and insight. Today, Francesca steps into the role of guest host, asking the probing questions that illuminate the philosophy of AgeLess, reveal stories from my practice, and surface the research that continues to guide our journey. If you believe aging deserves a richer, more authentic narrative, we'd love your support. Please subscribe, review, or simply share this conversation with someone you care about. Francesca, welcome, and thank you for joining me on AgeLess.
This is amazing. We have so many conversations offline, you and I, about all of these concepts, everything that you do in the aesthetics industry, and it's exciting to be having this moment here together. What can you tell us about AgeLess as a concept? What are you going to be exploring within the conversations that are obviously going to start unfolding?
So for so many years, I've been working in medical education.
Yeah.
And now we're in a world where there is so much misinformation and disinformation that I really feel called to create a space where we can have an open dialogue and really discuss the evidence behind health and well-being. So there's three key pillars to AgeLess. There is healthy aging, and from a physical perspective, from a mental perspective, and the physiology behind it. Medical aesthetics, so we bring those together, but also mindset and self-development as an overarching cocoon for all of it.
I love how you're overlapping all of these really relevant but somewhat slightly disparate subjects and really sort of making a talking point and a conversation out of them. And I think, why is stepping beyond the sort of numerical construct of age so key to your philosophy? We've spoken a lot about agelessness, ageism, not being defined by our age. Why is this such a passion of yours?
There's a really clear inspiration for me. As you know, I've been over 20 years in clinical practice. And it's my patients. It's thousands of patient stories where I've been looking after patients for almost 2 decades, some of them. And I've heard the stories of discrimination, of bias on a personal level, on a social level, in terms of career, how it's affected relationships, how it's affected how they feel emotionally in terms of invisibility, and the stereotypical aspects of age, be it you're too young for this job, or you're too young for this position, suddenly you become too old.
Yeah, that's so true.
And that can be really pervasive in terms of the too old narrative. So it's definitely inspired by my patients. It's been a huge privilege over the last 20 years. So when they first come in, I write down a number. And quite frequently, there's a lot of patients that I'll see every 3 months, every 4 months. And over a long period of time, I have to honestly say it's very rare that I mentally think actively about that number that's attached to them.
Yeah.
It's sat in the background from a physiological perspective. So as I'm treating them, I'm looking out for different signposts and different moments as to where things might be changing anatomically, cellular, physiology-wise. And then I'm also looking out for key moments in terms of health, medical illness, significant stressful events that are happening with them. So I'm thinking in both terms, but I don't actually engage with my patients as you're this age.
So you're this number and you're going to be defined by this going forwards.
Absolutely.
So important.
I've seen it so much within medical education. It's how it's often taught.
Yeah.
Certainly within the beauty industry, I treat a lot of actresses and actors that are very, within the public eye, all sorts of people. And there are so many moments where they're defined by their age. So I also have some really serious concerns around Generation Alpha, a lot of the children that are coming through in terms of what they're seeing in terms of ageism. So I know we'll get onto that, but it's going throughout the generations and throughout all ages. I have concerns about it. But then having said that, yes, I've witnessed the challenges that have happened, but I've also seen so many incredible success stories.
How do you hope that this podcast will inspire the people who listen to it across all of those different generations and backgrounds?
I really hope that it can. What I would love to do is bring the work that we do in clinic at One Aesthetic Studio. As you know, I've had my own clinic for 15 years, but I've been in clinical practice for much longer. And it's very special what we do. And as you said before, it seems that these areas are disparate, but less so than it was. So I don't know if you remember when I opened the studio side to the practice after I did my yoga teacher training.
I do, yes. It's such a beautiful part of the clinical space now.
Thank you. I remember you being one of the first people to visit. And I remember going to a conference very soon after I did that. And I remember the time of year it was, and so many people came to me and they said, you're going to affect and potentially damage your academic credibility for the fact that you're bringing in the holistic aspect of things, the spiritual side of things. We know that you're bringing other types of holistic practitioners in.
Well, it was really
could damage
frowned
you
upon, sort of, going back several years. And I think you're right. There has been such a shift in how we perceive the bridging of those two worlds. I think they used to be seen as very separate sides of the coin.
It's been such a crucial part of my clinical work. I can't imagine doing it without it. So even before I had the studio, I've always been so driven by mindset, by mental health. I remember being 10, 11 years old, and I was always drawn to, back then it was the self-help section of the bookshop, right? We didn't
which was probably tiny and sort of completely undersubscribed and empty.
Really, and often there was a real, again, stigma associated with that, where it might be a little bit associated with shame or just embarrassment, or there must be something wrong. But I was really young, and I was a big consumer of that content, very, very young. And I really attribute a lot of my progression and where I am today to those early years and my interest in that area. And then, part of my work and my first degree, I majored in neuroscience and psychiatry, and I really studied deep in terms of ADHD and all sorts of other aspects. So it's been a really truthful part of my work. It's really true.
I think the psychiatry, the sort of really deep understanding of that human psyche is always something that I've seen run through your work. You can hear it when you talk about the work that you do, when I've seen you consult, when I've seen you stand on international stages and present at conferences. I think you're very much an individual who is driven by how you can help other human beings. And I think that's sometimes lost in medical aesthetics.
Absolutely. It's been something I've been campaigning for so long. I remember being on an international podium maybe 15, 16 years ago. It might even be longer. And I'd always talk about the marginalization of beauty, those that weren't represented.
Yes.
So in terms of diversity, in terms of facial deformity, scarring, etc. And I'd always present it. It didn't matter what I was talking about. I would always be a voice for them. And I remember it just being completely overlooked. And it was, Jonquille's talking about that again and whatever. And I remember the definitive turning point, and that was in 2020, when then suddenly it became a little bit more in trend.
Yeah.
To start to talk about D&I, right?
Absolutely.
It felt like there was a tokenism to it. So I have to say that, within the work that we do in the clinic and within the studio, it's always been really real. I've always had so many patients that have flown in from all over the world, 6 continents. And, again, that's been a huge privilege to see that and to learn about so many different skin types, anatomy, body types, faces, and the patient stories. It's the patient stories and what's motivating them and what's driving them to that. And I've said before, this inside beauty, this inner beauty and how it's related to our outer selves and our outer beauty, again, I feel it's been very much commercialized. I think there's a lot of people who are working in these spaces who don't really know what it means. And it might be very innocently. They might not really feel into it. But there are practitioners who do understand that. And it's something that, again, specifically in the studio side of what we do, I don't appreciate the hollowness and if we're just treating the outside of it, it feels really, really hollow. Whereas if we're retreating the entire person and trying to understand what their motivations are and supporting them with that, that's where complete health starts.
I agree, but I think it also sort of runs deeper. I think it's almost in your DNA as an aesthetic physician, as a surgeon, as somebody who researches, a beauty scientist, somebody who lectures, somebody who works as a trend forecaster with these big global companies. I think it's almost the weaving in together of all of those disparate elements which enables you to go that much deeper.
This is absolutely key. And, in here, I have a few of my favorite papers and work that I've published. And one of them is Understanding Different Patient Archetypes. We published this in the Journal of Cosmetic Dermatology in 2019. And this was with an American plastic surgeon and an Australian plastic surgeon. And we studied 54,000 people worldwide in 17 countries.
My goodness, how fascinating.
And it was a really special moment because we based it upon the Jungian psychology archetypes. And we found that there were 4 key types of archetypes of people that were presenting for aesthetic procedures. And this was the first time this was really brought together. And
who are those 4 different types?
The 4 different types we found there were positive ages. So
I love that term.
The positive ages, again, we were really the first to publish on this within this space. And they are part of my inspiration for AgeLess as well, are the people who they accept the age that they are, but they want to age well.
Yes.
And again, at this time when we were actually collecting this data, this was something that was, okay, is this an emerging thing? Well, no, it wasn't, because every day in clinic, I was hearing from patients, well, actually, I'm okay with the age that I am, but I just want to age really well. So that was that real moment when we really started to talk about what it means to age positively. And I think that really changed a lot of the narrative, because before that moment, still there was a lot of conversation around anti-aging when we were in the medical community and within the beauty community.
And all of the beauty products, it used to be written on the side of every pot of moisturizer. You would get, anti-aging moisturizer, anti-aging serum, everything was about anti-aging. It was the number one word that would sell a product off a shelf for a long, long time.
Most definitely. And so I really remember that moment, and I remember standing on the podium and talking about this, and you could just feel it starting to filter through. And now it's a lot more accepted, and that's why for AgeLess, I am most definitely saluting my patients who are the positive ages, and that's why it says AgeLess. It's just a little nod to those people who they do embrace the age that they are, but they're just wanting to manage it well.
Yeah, exactly. Hand in hand with the right practitioner, I might add.
Yeah. This episode is sponsored by SkinCeuticals. I performed the clinical research and launched P-Tiox peptide serum by SkinCeuticals to the medical community. Along with my international colleagues, I published on the real-world impact of P-Tiox serum. We found that it targets lines caused by repetitive muscle movement, as well as smoothen other more difficult to treat wrinkles. With a precisely calibrated blend of peptides and PHAs, I use P-Tiox personally and with my patients to help soften lines, refine skin texture, and boost radiance for that luminous glass skin finish. You can redeem an exclusive 15% discount on P-Tiox serum at my clinic. Follow the link in the show notes for more information. Now,
Who are those other patient archetypes? So you have the positive agers and you have another 3?
We do. So there's the beautification archetype.
Yep.
And often this is what is assumed within the aesthetics area. And
that we're having these treatments because we want to enhance.
When it came to beautification, when I first started to speak about it, again, many of my medical colleagues would assume that it was people in their 20s and 30s, so millennials at that point in the early Gen Z.
I think particularly when we saw sort of such a huge focus on things like lip augmentation, or, you know, there was a point in time, probably about 8 to 10 years ago, where doctors were being encouraged to use very high volumes of dermal fillers to build up the anatomy and replace the, you know, I think sadly a little bit of that was then given a very negative connotation and linked back to this generation.
Definitely. So we've seen the millennials go through that. And at the time I was really concerned because I was thinking, actually, 10 years down the line, what are these patients going to start to look like? And then again, there was the projection of stigma onto Gen X in terms of beautification. Oh, surely they're at this stage of their life. Aren't they too busy with children or their career to be concerned about that? Then we saw it with the older Gen X and with the boomers, where it was surely, I mean, I was seeing patients in their late 70s and early 80s, long before I published on this, who were just endlessly driven by beautification. And it was in such an extraordinary way, though. They were so chic. Yeah, there's just some real standout patients of mine who they'll always be an inspiration. The way that they've walked into clinic and with such confidence, but with a really open mind as to, you know, what do I need to do now for my skin health? Is it too late? No. What about the rest of my face? What about my neck, my chest, my body, my muscle tone? What can I do to help myself? And what really inspired me about those patients in particular was it was like there wasn't a shame with them. They, you know, it wasn't beauty as judged. It was, no, this is a really inherent part of who I am today. And they would walk in, they were chic, they were still interested in fashion. They were, you know, on the nose in terms of what was happening culturally. So iconic. And they stay with me. These patients stay with me. Some of them, unfortunately, you know, have passed away now. But they will always stay with me. And yeah, really, really, really special. So yes, beautification patients, they can be in their 70s and 80s and beyond, and they can be in their 20s, you know, and children.
So we have the positive ages, the beautification patient. Who are the remaining categories?
So the other one is correction. And this incorporates patients who have perhaps facial deformity, scarring. There may be a clear area that they are seeking to correct. It's more their language. That's why we named it that. It tends to be the patient that presents and says, I'd like you to correct this part in me. So, wow, incredible patients again over the years. I've had incredible patients where, you know, one was born with half of the face. Patients where parts of their skull has been completely not formed and developed within the womb, and then by the time they're born, and then, you know, they might hit 5-6 years of age and they've had 10 surgeries by that point.
I was going to say, these are lifetime journeys you go on with patients as well, aren't they? This isn't just to sort of come in and have a few mil of filler. This is, we're your support network more than anything else.
Definitely.
We're putting you back together.
Definitely. And I feel really honoured that those patients have chosen me over the years. They started to come through, I think, because a lot of my earlier work, in biotech when I was working full-time as a research plastic surgeon in biotech, and it was phase 2, phase 3 studies.
Yeah.
And we worked a lot in scarring and preventing scarring. And so these patients would find me. And if you think about it back then, nobody was really treating patients with facial deformity within the aesthetic world. People didn't understand how to treat it. There weren't methods. There weren't techniques to do it. Mm-hmm. So I just softly went on these journeys with the patients, utilizing many different methodologies, creating my own techniques, using lasers, devices, injectables, skincare, many different methods, some non-surgical and some early, less interventional surgical procedures. And it was just so heartwarming. The sorts of patients that were coming to me saying, I've had 20 surgeries in my lifetime, but I can't sip through a straw. I am now entering a different point in my life where my career's taking off and I need to do more public speaking. I'm going to be public facing. There's going to be people looking at me. I'm going to be on camera. What can I do? And these were just transformational moments and very, very special.
It requires such a sort of intricate understanding of the anatomy to know how to use all of these devices, these products, these injecting techniques, how to work with the muscles, what to relax, what to strengthen, to create that sense of balance and sort of symmetry and restoration to a face. It must be such a rewarding part of the work that you do.
It's one of the most rewarding parts, and it's something that I will always work within and beyond. So I felt so strongly about it, and particularly within the aesthetics arena, that it actually took me years to publish this one particular piece. It's this one. So published in Dermatologic Surgery. And again, it's something that I haven't spoken enough about, but there aren't enough systems and methodologies in order to treat these patients well. So I looked at huge amounts of literature. The thing that makes it difficult is that every single patient within this group present completely differently.
Yeah.
So you might have 10 patients that have had facial palsy, where one side of the face has been affected by nerves, be it from infection, be it from trauma, congenitally from birth, so many different reasons. But the way that it presents is so unique and so challenging that you can't have a pro forma.
There's no painting by numbers. I mean, in fact, we apply this to every patient that probably passes through your doors regardless, but every patient is individual. Their anatomy is unique. Their characteristics, their personality is unique to them. But I imagine for the reconstructive, the more sort of deformity-focused cases that you're managing as well, that is all the more sort of relevant.
Imagine how difficult it can be. And I'm used to seeing such a breadth and depth of these patients who are presenting. And then the problem is particularly in the UK market, but actually worldwide, these patients are seeking out procedures, they're seeking out help. And there's practitioners who, really have great intentions, but they won't necessarily know how to treat them. Yeah. So they're an extremely vulnerable group. So what I've found is in my work, a lot of people know that this is a real area of specialism. So I do get a lot of tertiary referrals to me from other doctors, from other professors, etc. But there's still a huge amount of work to be done. And what I found from the literature was that there were hardly any guidelines.
Yeah, I can see that. And it's something that absolutely needs to be improved, as I think we sort of go on to respect the individual patient so much more.
Yes.
The one thing we haven't touched on in your career is how you, I think, really democratized this space by bringing it into a luxury department store. So you were, I think, probably the first aesthetic physician to integrate the work that you do into that much more democratic landscape with your launch into Selfridges. Yeah. I remember coming to visit you when you first opened it. How do you think that shaped what you've been doing over your career in the past years?
What was interesting about the London department store moment was the types of people who were walking through the beauty hall wouldn't necessarily present for plastic surgery, for cosmetic surgery, or for aesthetics, but they were huge beauty consumers.
Yes.
So I'm in there and I was in partnership with SkinCeuticals, as you know, and it was a really big moment. SkinCeuticals are part of L'Oreal. And,
it was an amazing moment. And space, I have to say, very beautifully designed.
Thank you. And we do a lot of work together in terms of beauty research, consumer research, and obviously actually the clinical product development studies as well. But we were in there, and I would be stood there listening to the types of advice that was happening at
all the respective beauty counters around as well. How interesting.
It was really
a fly on the wall.
Interesting.
What did you glean from it?
Again, from an education point of view, just how much bad advice is happening. Just the extraordinary level of advice that was being given. And again, I'm sure not with bad intention. That I'm sure it's not with any sort of malintent whatsoever. But it spoke to me as to how much education was needed within these different beauty brands, who are then responsible for who is talking to consumers on the shop floor. So when I was in there, I would do educational events with the other brands, actually, just talking about aging, talking about the physiology and the health of the skin. I think that was a real pay it forward moment as well, I hope.
Yeah, absolutely.
That helped those people to think a little bit differently. But I was hearing a lot of things that weren't right at all, where there were patients with absolute bond or rosacea, and they were being told to put things on that were going to make their rosacea far worse, or were clearly presenting with skin disease such as eczema, and that was going to make it worse. Or very young consumers who were being told to pile on all of these different serums, most of which probably didn't have enough active ingredients to do any good, but may have actually done harm to their oil glands, So
absolutely.
it was such a melting pot, and I learnt a lot from that. I really did.
It was a very special moment, and yes, it was amazing to come and see you in action in London, where I'm always trying to get you back to.
I know.
We need to make it happen.
I know, and I mean, before I've always worked on Harley Street before I did that, but most of my patients, they do fly in. They take the train up from London. They fly in from all sorts of places.
And it's nice to escape sometimes.
Well, there was one more archetype that we didn't touch on, and it was the transformation
the fourth archetype. Yes,
that's right. And just as well, I'd like to say that I'm also thinking beyond these four. This was our initial work on this.
Yeah.
So of course, there's patients that will flow between them. And I think there's many more beyond this, but this was just a first moment as to trying to break down the motivations and the psychology behind some of these patients. So the transformation archetype are so fascinating. I first saw them in clinic in Manchester because we see a lot of gender transitioning patients, gender fluid patients. So their underlying motivation was to transform, if we're talking about gender. I then saw it within the other groups where they were positive agers or they were beautification patients, but they were still wanting to transform in some way. And again, this plays into the studio aspect of things that we do, where it was part of a self-actualization process as well. So I was seeing those patients who were in terms of transformation, and then my work in Asia. So I've been very lucky. I've worked in multiple different provinces in China. I've worked in Japan, Korea, Indonesia, Malaysia. It's been extraordinary. And I remember the very first time I went to China. I think I've done 7 tours of China, perhaps.
Oh my goodness.
Speaking,
that must have had such an impact on how you inject, how you teach.
Huge. And can you imagine being invited into these areas where I can't speak the language, I can't read the language, it's difficult to communicate. So I had a simultaneous translator. But to be invited in to actually teach with their people,
that's phenomenal.
It's so that meant I had to learn myself about their cultural
cultural archetypal transformation patient.
They started to trigger thought because I first went into one of the clinics and I remember it was huge. It was almost like a department store itself. And there were chairs upon chairs of mostly girls. They were turning 18 and they were sat in chairs and they were waiting to be injected. And they were wanting chin,
Yes, to create their heart-shaped face. I also heard that the Asian blepharoplasty is something that pretty much by the age of sort of 23, most girls in Korea will have had done.
Yep, most definitely. Nose, subtleties around couldn't have too high a cheekbone depending on where we were in Asia and certainly in China.
Yep.
Temples that has cultural beliefs associated with fortune. There were so many fascinating aspects. I learned a lot about face reading.
The laser toning, the skin sort of, trying to have that perfect glass complexion.
Yeah. And
it's fascinating to look at.
These girls were turning 18 and it was one of the first things that they would do. You also see it in the Middle East, of course, but the first thing they would do would be they'd be going in to see a doctor. And at that point in my career, it would have been easy to have had very, very strong position on that. And part of me did.
Yeah.
Because was I treating 18-year-olds at that point and completely transforming their face?
No.
I wasn't. And certainly if anybody got through my clinic manager and my nurses to then see me, there would have been a very careful and gentle conversation and multiple conversations before anything would have been done. But this was a real shock to me culturally. But I went with an open mind, and it taught me to stay open-minded, to respect the different cultural motivations.
It's been such a shift in recent years, and it feels like everything that you've done has really fed into this as well, and this slight, I suppose, rethinking of what our industry stands for.
This is such an important point that you've just brought up, and I think this is a really critical thing that I see amongst my peer groups and within medical education. I would be bold to say that I think societies are far more informed in terms of this area, in terms of diversity, inclusion, and prejudices. I would say that the medical community are a long way behind.
Yep.
So I can think of a couple of standout moments. I did a tour within Europe, I think it was about 18 months ago, where I was celebrating and teaching on different genders. And in order to treat a female face well and how they identify, in order to treat a male face well and if they identify in pure masculinity, you would think that that was quite a straightforward thing to do. And it's not necessarily. And that's why we see so many poor outcomes where a lot of men can look feminized. Men can start to look very, very strange. We've seen with different trends such as jawline, again, something that I have contributed to, where women who didn't identify as masculine were starting to look masculinized. So that's a whole different topic. But then I was making it broader in terms of other genders. And I remember interviewing some extraordinary patients on the stage on these tours. Patients who have undergone abuse, assault, and so they were presenting as male at birth, but actually still had a uterus and ovaries, and at 6 months old were taken away.
Oh my goodness me.
But as they grew up, they were identifying as female, and that had been taken away from the terrible stories of abuse and assault.
I mean, psychologically as well, what the patient's going through there must be so hard to unpick.
It's impossible to fathom, and that's why it needs to be really well supported, and primarily it needs to be understood.
Yeah.
So I did a big piece of work on this, and there were a number of different lectures that I gave. And I remember then usually going to a Q&A in the audience, these extraordinary patient stories, very in-depth, complex teaching in terms of facial proportions and geometry. And then I would hear a really basic question from the audience that actually didn't understand what the term non-binary meant whatsoever,
because people weren't quite there.
No.
They hadn't quite got to that point where that was something that they could engage with yet.
No, and they were struggling to even differentiate between gender and sexuality. And I don't think that that's good enough, not when many societies are having progressive, open conversations around this, and everyone's entitled to their opinion.
Agreed.
Of course they are. That's not what we're talking about. But as medical professionals, our doors are open. These are the types of patients that may be seeking out support and help. It's our responsibility to understand it better and learn more. And certainly if you don't understand it, then refer on to the practitioners and the specialists that do.
Absolutely. And we always talk about it being a sort of partnership between patient and practitioner. And I think, there's so much that's laid at your door in terms of understanding how to engage with that patient and ultimately how to take them on that journey and deliver something that meets their expectations.
Yes.
Whether that is the transformation, the beautification, all of the sort of wonderful archetypes you mentioned. It's very, very impressive how it's all brought together. And I think it's really important that we're having this conversation. So I think we can really shine a light on everything, every facet, every nuance that goes into the work that you do.
Thank you. I hope so. That was part of my intention for this work now, is to open up that space, that I have the conversations that I have with the patients, the conversations that we have with patients in the clinic and in the studio, the medical education work, and that I'm hoping that it brings a little bit more thought and certainly a little bit more consciousness to these areas.
Absolutely.
I really, really hope so. And I think I am ready for people to ask me, is this a big rebellion against ageism? Mm-hmm. I'm ready for the questions with this. Mm-hmm. And it actually is, quite frankly, I think it's one of the most concerning isms that are still acceptable out in communities.
Yeah.
The World Health Organization quoted a stat that 1 in 2 people worldwide still hold cultural bias against age. Mm-hmm. It's a lot of people.
That is.
And so it is actually a rebellion against being defined by just a number, that you're too young or you're too old. You can't wear this, you can't pursue this, you can't be this. But it's also most definitely a respect to so many people who are wanting to age positively, but don't want to be defined by that number, and are really investing energetically, emotionally, financially in their health and in the longevity aspect and health span of their lives. So that's where it's at.
I think it's amazing to see your breadth of work and to talk about it in this way today, and really fascinating to see how it all fits together.
Yeah, and I think all of these interplay into the purpose behind AgeLess and what I'm trying to do here. So they've all had a really prominent and important contribution.
I would
to
agree
where
in
it's
listening
now.
to you. Absolutely.
Yeah. So rather than sort of starting off and everything else that's spun off, it's a constant consideration of everything that I've experienced and seen and contributed to, but certainly listened to, that I'm hoping to then move forward with.
Well, congratulations.
Thank you.
And I'm really excited to see where the rest of the podcast goes.
Thank you. I'm so grateful to you for coming on and bringing this to life and helping, as always, to so beautifully bring this in a way that I would have struggled to explain on my own.
I highly doubt that,
I would have
knowing
really
how
struggled
articulate you are. But no, it's been such a pleasure having the conversation with you, and best of luck. I look forward to tuning in.
Thank you so much. Thank you for joining me for this episode of AgeLess. What I hope you're taking from today's conversation is that aging isn't defined by numbers, but by your own perspective. When we choose to focus on health span, mindset, and self-image, we unlock a different way of living, one that resists cultural ageism and honours both our inner strength and outer expression. So what can you do this week? Begin by noticing the language you use about yourself. Are you reducing your identity to age or appearance, or are you honouring your wisdom and lived experiences? And if you haven't done so already, take one proactive step for your well-being, whether that's pausing to think before your choices, or simply investing time in rest and recovery. My philosophy has always been that medical aesthetics and aging science aren't about constantly chasing youth, but being in alignment with your evolution. Changes happen over time. Our self-image changes over time. And it's okay to change how you choose to express yourself or live your life. If this episode resonated, please subscribe, share it with someone you love, or leave a review. And as a thank you for being here, you can redeem an exclusive free skin consultation and 15% discount on the One Dermafacial with my team in my Clinic One Aesthetic Studio. Simply follow the link in the show notes and enter the code AGELESS15 at checkout. So I leave you with this reflection. What does ageless mean to you? Let that question be the start of your rebellion against ageism and false information. I'm Dr. Jonquille Chantrey, and this has been Ageless.